Here at the Royal Belfast Hospital for Sick Children, we know that having a child in hospital is both physically and emotionally draining. The hospital environment can make it difficult to sleep well, eat well, or move your body regularly. Parents and caregivers tell us how they feel concerned about their child, helpless that they can't take the health problem away, and often torn between the child in hospital and life outside hospital, perhaps by other children at home, by work commitments, or by financial worries. Taking time to look after yourself in this situation is really important, but not always easy. We have created this video with you in mind. We encourage you to take the next few minutes to follow along. You can be reassured that taking the time to take care of yourself, you will be better able to tend to your child. The following movements are designed that you do not need any special equipment, you don't need a yoga mat, you don't need any special clothing, and they can be done in a small space, either seated in a chair or even on the side of a bed, and you do not need to be lying down. So you can either do this practice seated in a chair, or you can come to standing. And for the purposes of the video, I'm going to be standing. And I'm going to have both of my feet on the ground, about hip distance apart. I'm going to take a little bit of a bend, a little bit of a softness into my knees so that we can have a little bit of bounce in the body. And then I'm going to begin to move one of my arms, and I'm going to move the other, and then I'm going to bring the legs into the movement as well. So you get to choose how vigorous or not vigorous this movement will be. So you just go with what feels good in your body. And also, if you have high blood pressure, we want to just keep the arms at the level of the shoulders. You don't bring the arms up any further than the shoulders. So again, a little bit of a softness into your knees, relax your shoulders down away from your ears. And we'll just begin with the left arm. We're just going to shake the left arm. You might even notice that the rest of my body is shaking a little bit, so you can do that if that feels good for you. So moving that arm, you can shake the hand, you can bring the movement into the arm a little bit more. So we're just increasing the rate of the movement. And you're just noticing any heat that begins to build up. You can slow it down, you can bring it back down by your side or bring it up. And then we'll bring the other arm in, so both the arms shaking. So you can just literally feel the energy kind of coming out through the limbs. You want to slow it down, a little bit more vigorous movement. And then we're going to bring one leg in and then the other. And then you're just shaking. You might even bend over. You can bring the arms up over the head. You can shake one leg again, another leg. And we're just going here to move the body, just getting that energy, all that restless energy out of the body. You can bounce a little bit. And you can move, and we're going to really now bring a little bit more energy into this movement for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Let the arms release down by your side. A little bit of softness back into your knees. And just feeling the heart rate now, the heart rate will have increased. So just letting that settle. Taking a breath, exhale all the energy back down through the legs, down into your feet and into the floor. You can take one hand onto your chest, the other hand onto your belly. Let the elbows be soft. Lower your gaze down to the ground and just notice the sensations in your face. Noticing the sensations in your cheeks and your mouth. And just letting the breath settle. Elbows are soft. Just letting the energy settle back down. Letting the energy settle back into a regulated space. And breath slowing down. Allowing the movement to just move that energy through your body. And then when you feel ready, just lowering your chin down towards your chest. Feeling a stretch along the back of your neck. And the eyes can open. And then again, when you feel ready, bringing your head up. And just taking a little look around the room, back into your immediate environment. And then bringing the practice to an end.